So this one is about the radial nerve and its clinical significance. So I just want to get through that pretty quick, and I think I can do that pretty quickly. So just hold on. So first of all, we know the radial nerve rises from the posterior cord, and the cords are usually termed in relation to the axillary artery. So in the sense, posterior cord is posterior to the axillary artery. So now we need to talk about how the radial nerve comes from there. So the radial nerve comes posteriorly from rises from the posterior cord itself. So it runs through the lower triangular space to enter the posterior aspect of the arm. So the lower triangular space is one of the boundaries that's made by the long and lateral head of triceps, and it is major. So it passes there together, being accompanied by the profunda brachiae artery. So comes from the posterior cord between the long and lateral head of triceps, pass along the radial groove where it is between the medial and lateral head of triceps, pierces the lateral intermuscular septum to enter the anterior aspect of the arm, right, the anterior part of the arm. So now it passes between brachialis and brachioradialis, and passes into the elbow, innervates brachioradialis, extensor carpi radialis longus, then divides to give off the posterior interosseous nerve, which is the deep branch of the radial nerve, and it's purely motor, and then a sensory branch, which passes underneath the brachioradialis. Now, the posterior interosseous nerve, like one of the commonest relationship that is usually remember this division into the deep and the superficial branch occurs at the level of the radial head, and this posterior interosseous nerve is usually passing between the two heads of supinator. And then the deep branch is the posterior interosseous nerve, as I mentioned, goes on to supply the rest of the extensor muscles of the forearm, while the sensory nerve goes on to supply the dorsal radial 3.5 fingers. Right. So now this is basically the cause, and the reason you need to know the cause is so that you can understand significance, because always know that just learning the theory alone will not be enough. When you're treating patients, you have to know the clinical significance. With the now cause complete, now we can talk about where what happens, and what are the defects that you will start to see. Right. So now for an example, let's say the level of injury is at the very higher up, in the arm. So what is the commonest like thing is, the person overhanging behind a chair for the night. They come with something called a Saturday night palsy. Saturday night palsy. So this is where you have, some kind of compression at the very higher level. So because now, the innervation of the triceps occurs really higher up. So at this point, the triceps, pretty much everything below the triceps, you will notice that there is a motor deficit. Like everything that the nerve innervates or gives supplies to beneath that level is gone. So that could be the triceps, the wrist extension, as well as the finger extension, and also the related sensory innervation. Now, come a little bit lower down at the arm, let's say at the radial groove. Now here the triceps would be spared. The reason for this is that because the innervation for the triceps has already occurred higher up. The long head and lateral head receive the innervation somewhat higher up. So now the triceps function is spared. So you have extension at the elbow joint taking place. Now let's go down. The wrist extension would not be happening because the innervation lower down is somewhat gone, because you need the brachialis, extensor carpi radialis longus. So those kind of things will not get the innervation, as well as finger extension. So again, finger extension, those things are gone, but the only difference between the higher arm as well as the region at the radial groove would be the triceps. Now come even further down. Elbow joint. Here we talked very importantly about the posterior interosseous nerve. And before, like, the posterior interosseous nerve itself comes, like the very important thing usually when they say an elbow joint injury, it's what can you say, like if it is at the level of the posterior introductus now, like when it is getting branched off, that's at the radial head. The thing is, at this level, already innervation has occurred to the brachioradialis as well as extensor carpi radialis longus. So, which actually gives to one of the conditions pin palsy. We have wrist joint extension. You're still possible because of these, muscles, brachioradialis and the extensor carpi radialis longus. So these muscles are enough to do the wrist joint extension. But the remaining components, which is the rest of the extensors, right? So you have weak wrist joint extension, but extension is possible, but the fingers extensions are gone. So that is one thing. Now let's say you have an injury at the wrist joint level. Now here, now what you could only be affecting is the superficial radial now, because the posterior interosseous nerve is a deep branch that goes on, then the superficial radial nerve goes on. So here you will have loss of the innervation, sensory innervation, right? No motor innervation, because you have already got your motor innervation going through the posterior introsus now. So when a defect occurs, this is probably much the best way to say it. You have to talk about the motor component as well as the sensory component, and at what different levels. Mostly the levels you talk about are higher up in the arm, at the radial groove, at the elbow joint. And elbow joint here, the complex thing is the posterior introsus now, right? Because if it's at the level of the branching off at the radial head, then your posterior introsus nerve, even prior to that, you have innervation to muscles and wrist joint extension is possible. But if it is before that, much higher up, like I don't know, perhaps at the supracondylar level, then it is likely you might be losing your wrist joint extension as well, because the innervation to the brachioradialis is not there. So again, depends when you say elbow, at what point. All right.